So with urologic conditions, it's a unique relationship that someone has with their urologist because typically they're affecting parts of their body that they wouldn't normally talk about in public or with family or friends, or the side effects of having these cancers or any kind of treatment affect them in ways that, again, you wouldn't just normally talk about or some people may not see. So I think it provides a unique relationship to have with a urologist in that it has to be very open and a certain amount of understanding and empathy for the unique side effects or presentation that someone may have with these types of diseases. So when I see people in clinic, I try to keep that in mind. They're going through a very tough situation that's hard for them to relate or talk to with other people. So I always try to encourage patients that they're not alone, that there's a lot of other people like them who have these things, even though they may not talk about it or know about it. They're actually quite common, more than you'd think. And I think keeping that in perspective helps us to have an open relationship where we can talk about these sorts of issues that are very difficult.